that we shall receive power, if only we tarry with you for a while. Oh, mighty breath of God, we honor you.
Take a deep breath in the midst of a busy day. Download our app and listen anytime, anywhere. Visit radiopulpit.co.za.
Phulaphula iRadio Pulpit ukhanyiseleke kweli lizwe elimnyama. Zivulele ngokwakho i-app yethu okanye umamele ku-radiopulpit.co.za. Siyafumaneka ku-DSTV audio channel 882 ukanti sikhona na ku-OpenView 607. Radio Pulpit 657 AM. Umhlobo wakho wemihla ngemihla.
That's where you're at on Radio Pulpit, your daily companion. I had to put a pause there, play Naledi Shwe, and then we'll come back. We'll come back to Michael David. How great. And just to cross over to my queen, Dr. Inga Mgaleli. She's on the other side. Hi, my queen. Good morning.
Good morning. Good morning. How are you?
I am blessed of the Lord. Welcome to Radio Pulpit yet again today.
Thank you for having me, as always.
Yeah, now you say that you just told me that you are battling some kind of flu. Is it because of the dust? Because there are so many people who are fluish right now. Is it because of the August dust?
Yeah, I think it might be a combination of that. But I was also traveling over the weekend, and it was quite cold. But I think maybe exposure to the elements just really got to me. But I'm well on my way into recovery, so so when somebody.
No, please get healed. Please get healed. For the first time in many years, we can tell that it's August with the dust. iPad.
No, and it's windy. Everywhere you go, it's windy.
But I'm glad that we can tell it's August because for many years that didn't happen. We were like, Kanti, what's happening with our climate? What's happening with our weather?
Climate change, that's bad.
Yeah. So, my queen, we're talking today, we're answering, and family, let me just remind you that you can just send your messages, call in. Would like to hear from you. You get a question for Dr. Inga Mgaleli about any health-related issues pertaining to women. You can ask your questions, and the lines are opened on 012334. It's 0123341322, and our WhatsApp line 0826572729, 0826572729. Our SMS line 37871. We are taking your questions. Be it you're a woman, you have a medical issue that you want advice on, you desire to have advice on, that is huisbesoek vandaag, and so you can call in and praat met ons. Would like to hear from you, gesels met ons. We are right here for you. Be it you're a man, and maybe your wife is going through something that you need advice on, or your mother or your daughter, please call in. Please write in. We'd like to hear from you. But Dr. Inga Mgaleli, what are some of the common challenges health-wise where women are concerned? I'm seeing a lot of women talking about endometriosis right now. I don't know if I'm saying it correctly. I'm seeing a lot from our young girls talking about that they're suffering from that. Is it something that's growing?
So it's not something that's growing actually, but it's interesting because women's health, we've been on a journey as a country and actually internationally as well. So endometriosis is not growing. It's not growing at all. It's always been there, and it's always had an impact on women. But the problem is that it's one of the conditions that hasn't been, a lot of research hasn't been poured into it. Due to restrictions in funding and all the like and things like that. And so you'd find that it wasn't something that was at the forefront of women's health because, it wasn't being, being prioritized. But there's been a shift in medicine when it comes to issues that affect women, endometriosis is one of those issues, and now it is sort of in the spotlight, whereas before it was not.
Sure.
It's also in the spotlight because prior or historically, it's been one of those conditions that, people have been, I guess I can say it sort of gets ignored. So you'll find a woman who's coming with severe menstrual periods, or they're coming with other symptoms, because endometriosis is vast. It's vast. What it actually is having uterine tissue outside of the uterus, essentially.
Yeah.
And it can be in your lungs, it can be in your abdomen, it can be in your ear, it can be in your eyes. Literally, it can be anywhere in your body. And every time, you go on your monthlies, wherever else you are having, that endometrial tissue, that endometrial lining, which is what you shed during your monthly, then you will be bleeding wherever else you are having that endometrial tissue. And so, but most of the time it happens in the abdomen, but outside of the uterus. And that's what contributes to the very severe
Menstrual pains.
menstrual pains. And in some women can also cause quite heavy
Bleeding.
bleeding. Yes.
Okay.
But what I'm saying is, before, what would happen is that women would get dismissed, when they are coming with these severe menstrual periods, because it's not normal to have, severe menstrual periods. It's one of the red flags to say that something else might be going on. But in the past, that sort of thing was being ignored. And so women were suffering in silence with endometriosis. And so it's sort of now under the spotlight, and more people are talking about it. And there's a shift now in medicine in terms of how we approach. Essentially, people are challenging that women should not be dismissed when they come forward with certain complaints and all the like. So it is quite interesting. I'm glad you asked that question. There's a lot of women who've been doing work in the background, to bring it into the spotlight. And so I'm glad to see it happening.
Sure. Yeah, I was going to ask you about dysmenorrhea, but now I think you clearly explained it, that dysmenorrhea what do we call it? Endometriosis can cause dysmenorrhea. We used to call it dysmenorrhea. Now it's called abnormal heavy bleeding. And the cramps that would come. So I hear, when we're talking about this, I saw even a post yesterday from one of the ladies on my socials asking, why do they always have to come with pain? Ladies, is it just me, or is everybody experiencing this? Now, I know that I have some ladies who talk about just knowing that, no, around this time, that's when I'm going on my periods. No pain, no cramps, nothing. Everything is going very well, which I envy them. Hallelujah. When it came to me, it started when I was very young. So I experienced that, and I thought it would change with having a child. But I still struggled a little bit after having a child. So there were myths that were surrounding it to say that if you are going to have a child, then definitely you're not going to have the pains and cramps anymore. Is it a myth, or is it, maybe it's just me who's seeing it as a myth? Is it a myth, or definitely when you have a child?
No, so it is a myth in the sense that there's no factual evidence to back it up. But it's quite interesting because dysmenorrhea, which is the pain, and then the term for when it's heavy menstrual bleeding, as you correctly said. So those are two different things. But what I was saying is interesting with both. It can be this manifestation of hormonal imbalances, or rather, it depends. Because hormones are they play such a big role in our menstrual cycle, and so even a lot of the time, one of the things that we trial when women are having these issues is hormonal contraceptives to see if they will respond. But of course, it's trial and error. It doesn't work for everyone. And so I suppose because of the hormonal changes that come with pregnancy, post your pregnancy period, you may either have your period pains may get better or they may get worse, depending on what state you normalize to once you have recovered from the pregnancy state, and that all goes hand in hand with hormones. I can share a personal story about dysmenorrhea. I think I was in high school. I can't remember exactly how old I was, and I used to have severe crawling on the floor, kind of period pain. I could not go to school. And my mom was like, this is not normal. And she was also looking at me like, why are you suffering so much? I don't have this problem. Like she was one of the lucky ones. She hardly, period pains, she never really got them. So for her, it was quite strange to see me, essentially suffering the way that I was suffering. And so she went to a doctor. And then they tried me on, hormonal contraceptives and pills and stuff. And then afterwards, I was still getting period pains, but they definitely weren't as severe as before. And that's really what is the important thing about understanding women's health issues, is that these sorts of issues can be very debilitating. They can really, really, really impact and affect your quality of life. I share a personal story, with that, and I also know many other women who have quite debilitating period pains, and sometimes it's endometriosis, and sometimes it's fibroids, and there's a lot of other underlying medical issues that could be causing you to have those problems. And historically or previously, you go to the doctor and you sort of get dismissed. I know this is just period pain, whereas really it could be something, and something can be done.
Yeah. So now, but is it normal for women to just experience pain every month, so they know that no man, when my period comes, then it comes with pain? Is it a normal thing, or should we be going to doctors to check what causes the pain? Shouldn't they just come easy like the others that we were talking about?
No, so it is normal because when during that period, your uterus is physically there is cramping that happens there. So we do expect that there will be pain, but it should not be severe. It should not be debilitating. So that's when it becomes a red flag. When it's so. Of course, we all have different pain thresholds. So I just mean that. Pain that really, 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 really you can't tolerate.
It's paralyzing.
It's inducing, some people have pain that's so severe that it makes them nauseous, it makes them vomit. So it can sometimes be described as part of the PMS, but you find that it's actually being caused by the pain. And so that kind of pain is not normal. We don't expect it shouldn't be that severe. That's when it becomes a red flag. There's when you become worried, and that's when we need to start looking that maybe look, there are other causes. And then also with dysmenorrhea, there's something called primary dysmenorrhea and secondary dysmenorrhea. So primary dysmenorrhea is when from the onset you have period pains, right? From the time when you start your period until they stop, you have period pains. That's what we call primary dysmenorrhea. And we tend to be less concerned about primary dysmenorrhea than we are about secondary dysmenorrhea, right? Which is when you start your period and you're fine, and then later on you start developing these period pains. Of course, we know that when you start menstruation, it takes time, because it's all hormonal, it's all related to hormones. So it takes time to find a safe state, and so. For you, that secondary could actually be primary. But I just mean, let's say you started your periods when you were 10 or you were 11, and then now you start experiencing period pain when you're 6. That's a red flag. That tells us that perhaps there is something else that is going on. It's not just the uterus that's cramping. it makes us to be concerned that, okay, maybe you now are developing fibroids, or there's something else going on.
All right. Sure. All right. So, what are some of the things that you advise women to do? And a family member is asking, Spongile, please ask Dr. Inga Mgaleli if food also plays a role, because I know that I become so bloated every time I eat milk during my periods.
Yeah, so that's correct. There are certain foods that will make you feel a certain type of way, and it can tend to be exaggerated around around the time when you are having your monthlies.
Okay.
But just also in general. So food does play a very big role, and also general, well-being. It also does play. It does play a role. So they sort of go hand in hand, but there's no one specific food. I can't really give a generalization, but definitely bloating comes in general, and then there are foods that you eat that will make it worse.
Okay. So then you have to pay attention to your body, I guess.
Yeah, you just sort of have to listen to your cues, but it's sort of to say that, okay, you notice that when you drink milk around that time, that you become bloated. So in instances like that, depending on how much discomfort you're getting, it's either to try and reduce your intake or perhaps switch to milk alternatives. So your almond milks and because it just could be that it's the lactose in the milk that's causing you the problem. But it's just some things are trial and error to see what is working for you during that time and what doesn't.
All right. Shireen Arens, I see you, my queen. Hello, hello, hello. It's always an honor, my queen. Thank you so much for tuning in and listening in. It's so awesome. It's so awesome. Now, Dr. Mgaleli, when it comes to the periods that we are talking about and the endometriosis and all that, and let me say a woman is going on their periods, and they experience diabetic symptoms, maybe every other month, or I don't know, some months, let me not say every other month, some months they experience diabetic symptoms, and once their period is gone, everything is gone. What is that? Should they go and get checked for diabetes, or what happens?
So by diabetic symptoms, do you mean they get dizzy and
yes,
what?
Yes, even the night sweats and everything. What is the right word? I wanted to say peeing, when you pee frequently and all these symptoms that are there.
So look, I think I wouldn't necessarily say that they should get checked out, because around that time, so I wish I could show you the graph to show you just how your hormones are changing during that time.
Yeah.
We mostly have two hormones that drive the cycle, called luteinizing hormone and FSH. And then there are other hormones that are also released when you ovulate as well. So all those hormones, they have a very, the impact that they have on an individual is not insignificant. And that's why we have this period around before you start your period, your premenstrual
PMS?
period.
PMS?
Yes, PMS, what people call PMS. But I want you, the reason why I'm talking about the issue with the hormones and the changes that happen during that time is that premenstrual syndrome or cycle disorder, whatever, it can get so severe that it's actually also classified as a medical condition, as a premenstrual disorder. So it can get quite severe, and it can have very, very devastating impacts, where the mood, it's actually classified under mental illnesses as well. That's how severe the PMS can get, right? And that is related really to just how drastic the changes can be around that time period. And so, if some of the things that we experience, or the moodiness, the
The
moodiness,
cravings.
the cravings, the fragility, the dizziness. Some people get nausea. Some people do actually vomit. Sometimes it is related to pain. Sometimes it's just related to the hormonal, changes. It can happen in the absence of pain. Those are all part of this premenstrual or intermenstrual syndrome, or changes rather.
Okay.
And that's why when that period passes, then you sort of those symptoms or those issues, they sort of fall away. So it's not something that I would be too concerned about. Of course, if it's something that is impacting you quite significantly, and it persists beyond that period, then that's, I would say, look, this is not in keeping with the pattern that we expect. And so because it's not in keeping with the pattern that we expect, then definitely you should go and see someone.
All right. All righty then. Sure, I always say, Dr. Mgaleli, I'm pregnant every month. Because I have all the symptoms of a pregnant woman. So ever since I started going on my periods as a teenager.
Crazy. It's crazy because you're not pregnant, but you have symptoms of like you feel like. And when you're pregnant, you don't have those symptoms. It's like, can I have a break?
Yeah, so I've labeled myself like that ever since I was a teenager, that now every month I'm pregnant. So yeah, it's fine. And Juanita would like to know, what are the causes of endometriosis? Is there a treatment?
The causes, they aren't causes, right? They may be risk factors that may predispose you to having endometriosis. But what it is, as I explained before, is that the lining, so what you actually, the tissue that is in the uterus, which accumulates during your menstrual cycle and your menstrual, essentially during your menstrual cycle, that tissue migrates to other parts of your body where it should not be, right? And like I've said, most of the time it's within the abdomen, it's within the pelvis, but it can be elsewhere. Like I've mentioned, it's the lungs. It's been documented to be found in the lungs, in the ears. It can literally migrate anywhere, right? And that's what endometriosis is. It's endometrial tissue outside of the uterus and where it should not be.
Right.
There are treatments. So we first have something that we call conservative treatment. So that tends to be your hormonal treatments, contraceptives, and other things. But the gold standard for endometriosis is, surgical, where we go in and we look first to confirm that it is there, and then there are many techniques to then remove it. So always possible to remove it, but that is essentially the curative option is surgery.
All right. Another question says, what does it mean when you're told you got cysts in your womb?
Okay, so so this is sometimes the challenge that we have in medicine, is that we say things, but we mean different things. So it could mean one of two things. It could mean that you have cysts in your ovaries, and most of the time that is what it means. Cysts are fluid-filled. I guess I don't know how I can describe them, but they essentially they could be filled with fluid, or usually cystic fluid, but it's fluid that's not normal for that organ, right? And they usually tend to, be bigger in size, and sometimes they can be symptomatic, so they can cause pain and they can cause discomfort. and sometimes they can be completely like they can cause no problems. They can just exist in your ovaries, and you can have one cyst, or you can have multiple cysts. You can have cysts in one ovary, or you can have cysts in two ovaries. Most of the time, they're incidental findings. So what it means is that most women are living with cysts, but they don't even know because the cysts don't cause any symptoms. How we find out about the cyst is that you've gone in for something else and you needed to get an ultrasound, or you needed to get a CT scan for whatever other condition or illness that you came to the hospital with. And then when we scan you for that other issue, we happen to scan your ovaries as well, and then we see that you have cysts, right?
Okay.
And that's when we call it incidental finding. And we don't usually do anything about cysts unless they are causing problems. So most of the time when people say cysts in the womb, they're talking about cysts in the ovaries.
Oh, cyst in the ovaries. You. And are they painful?
They can cause pain depending on where they're located in your ovaries, and depending on the size, and depending on how many of them are there. So like I've said, they can cause pain, they can cause discomfort, but most of the time they don't cause any problems.
What happens if they burst? I've heard of somebody saying the doctor gave them a medication to get rid of the water in one of the cysts. Apparently, she would have cysts every time she would go on her periods. So just after the period, there would be a cyst there. I don't know what it means as well, but a doctor gave her some medication to drain out the water from the cysts that were there.
So it will be difficult for me to, sort of try and know what exactly that is. But most of the time with cystic conditions, depending on what symptoms it's causing, it's usually pain, and it can be discomfort as well. And so for example, if the cysts are, sort of with your monthlies, then that sort of cyst we wouldn't be too concerned about, because we know that it's hormonal related, unless it's causing significant pain and significant discomfort. But most of the time, we usually trial, like I've said, hormonal contraceptives, and then we sort of from there. There is also surgery to remove this. There is also something called polycystic ovarian syndrome, right?
Yeah.
And PCOS, what you call PCOS, and that is also a different. It's its own condition. And that you've got multiple cysts in your ovaries, and that one it's a hormonal condition as much as it is a cystic condition, where you have structural changes in your ovaries, but you also have hormonal changes in your blood, and that has quite some many impacts on the body. And so it's also one of the growing conditions that people are talking about. It's always been there, but it's one of the growing conditions that people are talking about, because it has impact on weight gain, weight loss, lots of other things as well. Facial hair. It just has an impact on a lot of other things. And so with a lot of these conditions, most of the time we try contraceptives first. But although there is growing research to say that, look, let's explore what other treatment options are available. For these sorts of conditions. But with cysts as well, massive cysts, we remove them. We can surgically remove them. Sometimes women can have cysts so big that they look pregnant, and those kinds of cysts we remove.
I thought it's only fibroids that did that.
No, cysts can also get you massive. So I've seen massive cysts, I've seen massive fibroids as well, and so those sorts of cysts we remove.
So you said polycystic ovarian, and there's also polycystic kidney.
Ovarian.
There's also polycystic. Okay, and
Yes, there's also polycystic kidneys. Yes, you're right.
So are they related one way or another?
No.
Do they present almost the same?
No, they're not related. Well, they're not related at all, or there's no link between the two. It's just how they've been termed because of literally what is happening. So you have multiple cysts in your ovaries,
Okay.
and then you have multiple cysts in your kidneys. So
Oh.
this one is a type of chronic kidney disease. It's a structural kidney disease
All right.
condition when you have kidneys. And then polycystic ovarian syndrome is a completely different disorder that has nothing to do with polycystic kidney disease.
Sure. I expected you to say, yeah, they are cousins.
No, no, they're not the same family tree. It's just they happen to share a name.
Okay. Dr. Mgaleli, what do we say to our women as we are closing?
Yeah. So, my only parting message with women is just to say that one, listen to your body, right? Trust your intuition. I think that we've seen in media sometimes women, especially in the obstetric and gynecological units, trying to seek help, trying to get assistance, and they get dismissed and they get ignored and they've lost their lives. I don't say this to scare anyone. I just say to say that your voice, is important. You know your body, and trust if you feel that something is not right. Trust if you feel that something isn't as it's just not as it should be. And please make sure to go get checked out. As we get older, our bodies are changing and we become at risk for certain types of conditions, so breast cancer, cervical cancer. I actually thought we'd touch on that one a little bit because it's the second leading cause of death in, cancers in South Africa. So it's one of the things that as we get older as women, we should be getting screened for. So get your pap smears, get your mammograms, just get your general health screens. And, if you just notice any drastic change in your body, please don't ignore it. Please get it checked out. It's always better to know and make sure that you're okay than to sit and watch, Yeah, and it's just to, encourage women, to keep speaking about women's issues and to be the voice. In South Africa, we are privileged enough that, we can have these sorts of conversations in media even. In other countries in Africa and across the world, such platforms don't exist. So we also have a responsibility to shed light on, where women don't have access to health, right? Yeah, so it's Women's Month. So let's celebrate, but, let's also think about where we can make a change and where we can make a difference.
Wow.
Essentially, last parting words for today.
Wow. And where can we get hold of Kiredi Doctors?
Kiredi, we on all the social media platforms, X, Facebook, Instagram, are using the handle at Kiredi SA, also on Facebook. Also active on LinkedIn, actually, and our website, www.kiredi.co.za, where you can get information about where our mobile units are across the 4 provinces and what we're up to. And every second Wednesday now, we also have an Instagram Live where we are talking about interesting topics from women's health-related issues, men's-related health issues, mental health, anything under the sun, we're talking about on our Instagram Live. And then, of course, our WhatsApp line, 060-019-0000, where you can chat to any of our doctors using that WhatsApp line.
My queen, get well. And you didn't sound any fluish at all. You sounded good. Thank you so much for talking to us this morning. Have a blessed one.
Thank you so much. Bye.
Bye, Dr. Mgaleli. And yes, my family, that is Dr. Mgaleli from Kiredi. And do remember that our regular live conversations with our young doctors are hosted, and you can reach out to them with your thoughts, questions, or concerns on social media handle at Kiredi SA on Facebook, Instagram, Twitter, and TikTok. Speak to a young doctor and ask questions by sending hi to WhatsApp number 060 019 0000.